Hi everyone, my name is Ebun. I'm a pharmacist. I'm also a prescriber. I specialize in mental health and I'm currently working in GP practices all over the UK. So why I decided to go into pharmacy, I wasn't actually going to study pharmacy. I wanted to be a graphic designer or an architect, but where I came from, that was not an option. So I decided to go on to study chemistry and maths at A-level because I did well at them in GCSE. So I did that and I was going to study medicine. I started the applications, work experience, everything, but I decided that it wasn't for me. Somebody came to speak to us about pharmacy in my college at the time, and I was like, oh, I've never heard of this, and I didn't know it was an option. It sounded good. It was only 4 years, and I liked healthcare, and I liked, that I was able to speak to patients and help patients. So I said, this is for me. So I did that, went to university, did my training in a community pharmacy for a year. And honestly, it was very, very, very tough because when you're transitioning from university to work life, I don't think they really prepare you a lot for the real life situations that you experience. A lot of patients that aren't happy, a lot of time is spent just making sure that everything is done in the right way. So I worked in community for majority of the years I've been a pharmacist. And I went on to hospital pharmacy where I specialize in mental health. And that's where I kind of found my passion for healthcare. I feel like in life, you kind of have to realize that you're on a journey and you have to realize that there's not a one road fits all. So for example, what your colleagues or what your friends are doing might not be what you're supposed to do. And the only way you can really find out what you're supposed to do is by going through experiences. So I was able to experience community pharmacy. I even worked for a healthcare consultancy in Mayfair, and I saw a different side of healthcare. So all of those experiences, I learned a lot. There were some times that were tough. There were some times that I wanted to give up. There were some times that I said, no, this is too much. But one thing that has helped me along the way is mentorship. And mentorship allows you to check what you're doing, because sometimes when you're in a situation, you can't see the whole picture. You only have a limited view, a limited amount of vision. But what a mentor allows or helps you with is to be able to see ahead of you, or for you to be able to see things that you can't see. So along the way, that really, really, really helps. So having a mentor to kind of check, be like, okay, you've done this for a year. Maybe it's time to move on to something else. And it led me to my passion, which is mental health. And not only mental health, but primary care. So that's when you're involved in, the day-to-day managing of patients through their GPs. And I never knew that pharmacists could even work in primary care, but it was just by experiencing, it was just by asking questions, it was just about being keen, being eager, and really just allowing, the journey called life, because I feel like sometimes we get disappointed where things don't go our way. You can not do as well in an exam, for example. Maybe you failed that exam. But it doesn't mean you should give up there and then. It might mean you need to go back to the drawing board and see, where did you go wrong? It allows you to evaluate. It allows you to ask questions. And that's why I find this journey of pharmacy so interesting. And it's become very fun because you have a degree that it allows you to be exposed to a lot of options, and that's why I love the healthcare profession so much, because you meet nurses that are consultants in palliative care and they've got so much knowledge, and then you meet doctors that are consultants in mental health and psychiatry, and it's just like they've got so much knowledge, but when you speak to them, you hear their experiences. So one thing I would say is follow this journey and don't let road bumps along the way bring you down. There was times, I remember in university, I failed an exam and I honestly thought life was over. I honestly thought that, how am I ever going to be a pharmacist if I can't pass this exam? But it allowed me to go back and be like, what am I doing wrong? and I was able to pass the exam and keep going. So definitely do not let those bumps stop you, and don't compare your journey to anybody else's, because it's particular to you. You know, you're you for a reason. You know what you enjoy, what you don't enjoy, and don't be afraid to explore. Don't be afraid to say yes to new opportunities. And definitely mentorship is something that I'm an advocate for. You know, there's so many people that have been in the field for many, many years, and they're very open to speaking to the younger generations, as so am I. So definitely that's something that should be part of your journey. So that's it from me, and I do hope you have a lovely day.